So moving on to the innate and the adaptive versus the adaptive arm of the immune system. All right. So innate versus adaptive arm. So remember we said that for the innate, deal with the B and T cells. So of course, circulating antibodies are produced by B cells. So and then the innate is talking about the other group of white blood cells, neutrophils, macrophages, monocytes, dendritic cells, natural. So all of that, including physical barriers. And then the bridge between the innate and adaptive arms, the APCs, called the antigen presenting cells. Right? Those are called the antigen presenting cells. And those group include your macrophages, right? Dendritic cells, right? Langerhans cells, and B cells. So what they are the bridge between the innate and adaptive arm of the immune system. So they take information from what's happening in the battlefield and take it to the T and B cells, enable them to know what's the B and T cells to respond. And the adaptive arm takes longer to respond to any problem, but once they respond, they have a memory, all right, and their response is specific to whatever is stimulating them. So it's highly specific, takes time for it to respond, but once it responds, it generates memory. While that of the innate, non-specific and very rapid. So when you have an infection, they are the first ones. The cells of the innate are the first that arrive on the scene before the adaptive arm, right? And then some of the things that are used, the chemicals. So immunoglobulins and cytokines more for the adaptive arm. And then in the innate, you're talking of the lysozyme, complement proteins, right? Well, cytokines for both innate and adaptive. So when we get to cytokines, we'll talk about that, right? But then when we get to talk about the proteins or chemicals specific for innate, talking of innate lysozyme complements, C-reactive protein, and defensins for innate, as the immunoglobulins for the adaptive. And also note here that this is germline encoded for innate, meaning you're born with it, it doesn't change, right? It's a response is like a hammer, like everything is a nail to a hammer, so to speak. While for the adaptive, it undergoes the VDJ recombination to sort of modify the response, the specificity of the T and B cells. Okay. Then another thing I want you to pay attention to here is this toll-like receptor, which is uh, for the innate arm. It's a very important receptor that these white blood cells of the innate system use to recognize pathogens. All right. And why is it important? Because once it's stimulated, this transcription factor is activated. And what's important for it stimulates the production of cytokines. So it stimulates the white, the white blood cells to produce cytokines, and these cytokines are the chemicals that will activate other white blood cells to fight the pathogen. So what does this toll-like receptor recognize? All these structures, right? All these lipopolysaccharide, flagellin, nucleic acid, all right? So we talked about memory cells for B and T cells. So they are very important. When the B cells have encountered an antigen, they'll still remember, have a memory of that pathogen, so that in future they'll be able to respond more rapidly to that pathogen. But the practical clinical importance of this is for vaccination. So anytime you want to you're vaccinating any individual, you're doing it to generate memory cells, so that when that individual encounters the real pathogen in the future, the memory B and T cells will respond to it quicker. Then another problem with the adaptive arm is that as the person ages, the response decreases with age. So that's immunosenescence. Right. So this affects both B and T cells. Where are some cells in the adaptive arm, like the macrophages, dendritic cells, they're also affected by immunosenescence. So their functional capacity decreases with age. The bone marrow, the ability to respond to new antigens also decreases with age. And what's the significance of this? The practical clinic, you have two patients from the same family but different ages. One is in the elderly, in the 70s or so. One is a younger patient. You give them the same vaccine against the same pathogen. The younger patient will go through, will be fine, but then the elderly patient will still come down with the same disease that you vaccinated him against. So that phenomenon is due to immunosense because his immune adaptive arm response decreases with age. So that's what is responsible for the decrease, the lack of the efficiency of that vaccine. All right. So moving down here, talk about the organs of the certain organs are sequestered or shielded away from the immune system, right? Such as the brain, the eye, the brain, the placenta, the testes. And what that means is that if they are injured for any reason and the immune system is exposed to the antigens or tissue or proteins released from that injured tissue that has been sequestered from the immune system, then the immune system will treat that organ as a foreign tissue or antigen and attack it. So that's the essence of what that immune privilege means. So just like sanctuary cities in the US where the immigration people can't go in there and catch illegal immigrants. So it's the same thing. The immune system can enter these organs, but if the organs become injured, the immune system will attack it like a foreign agent, foreign antigen. Right. So you have a question of where somebody has injury of the eye and then was getting better, and then suddenly the eye vision started deteriorating. Right. So that's a phenomenon there. And the benefit of that is that allograft rejection from this side will be less likely, right? Okay, so I think that's that for this. So let's move on to the questions